Walk too much.
Yes.
Okay, so it started getting significantly weak.
Right. If I run, I would have fall down that time.
Okay, so you felt like that there is a chance that if you try to overuse your legs, you can fall.
Yes.
Okay.
My operation, my surgery was perfect. I never had any kind of pain and no issue with the surgery. Yes, once this is over,
Yeah.
I would.
You'll be the happy man.
Yes, I would win a war then.
I have a patient, Mr. Abhay Kumar. Abhay, tell me, where do you belong? Where are you from?
Well, I'm from Jharkhand,
Okay.
but I stay in Noida.
Okay. So you work in Noida?
Yes, I have a small business in Noida.
Okay. What kind of work you do?
It's a frozen business.
Okay, frozen food. That's
Yes.
amazing. That's amazing. Okay, so tell me about what kind of problems you had when you actually came to us.
Well, I was having pain in my both hand.
Okay.
My right leg was having little less strength.
Weakness. Okay.
Weakness. It was hard for me to walk.
Oh, that it was weak to the point that you couldn't walk too much.
Yes.
Okay, so it started getting significantly weak.
Right. If I run, I would have fall down that time.
Okay, so you felt like that there is a chance that if you try to overuse your legs, you can fall.
Yes.
Okay.
And there was numbness, and sometimes it was stiffness, and that's tingling sensation in my
In your hands.
Yes.
Okay.
So I thought that it might be something really big.
Okay.
If I don't go to doctor and see, then I came to you.
So, since what time, Abhay, you were suffering from these kind of problems?
I mean, in my hand it was since last 6 months.
That's a long time.
Yes, but in my leg it was since 1 month.
So, did you try to take some other therapies before seeing me?
Not really.
Okay. Didn't try something like physiotherapy or medical?
No.
Nothing else?
No. When I realized that I may fall down,
Huh.
then I thought that okay, this might be something serious.
Yeah.
Yes. Then I said okay, let me go and
See somebody.
Yeah, see somebody and get a diagnosis.
Okay. So when you came to us, we diagnosed you with the case of a prolapsed disc in the cervical spine, and we did your anterior cervical discectomy and fusion under microscope.
Right.
So tell me one thing. Did you so we planned the surgery and everything went away. So tell me one thing. So did somebody not tell you that this is a messy thing? If you get operated on spine, you may not walk.
No, I went to a doctor.
Yeah.
He was a neurospecialist. He
Okay.
was not a neurosurgeon.
Okay.
And then he told me that that you took it lightly,
Yeah.
but this is really serious.
Okay.
You have to get it operated, and there will be a surgery, ACDF.
You need to. So you knew that it has to be
Yes,
done.
yes.
Practically, you came to me. You had already prepared your mind.
Yes.
And what kind of doubt you had before surgery? What did you felt? Was it stressful, depressing?
Well, if you talk about spine,
Mhm.
then definitely in somewhere in your mind you get a little stress.
Yeah.
And when it was on my neck, because C5C6,
Yes.
so it was a little critical junction there.
Yes.
But then when I came and see you and the way you took it, and then you made me feel easy,
Mm-hmm.
and one of my friend was also there,
Mm-hmm.
and he also called me, and then he supported me.
Mm-hmm.
Then I was like, okay, yeah, I'm good hand, then let's give it a crack.
Okay. So okay, you got admitted and then we operated. So what was your experience of the surgery? It was like very messy, painful, or something like that.
No, I never felt it.
Actually, there was no real pain.
No, I never felt it. When I was admitted here,
Yeah.
that injection was more painful than the
Then the
than the
surgery.
surgery.
That's amazing. Okay, that's great. So how was your recovery? How many days since after the surgery?
My surgery was done on 7th of February last.
And how many days later you were discharged?
Next day,
Next day morning you were discharged. In just one day.
just one day.
Just one day you were in hospital, and then ACDS are basically microscopic surgeries, so
Yes.
patient can go home next day. So you were discharged next day, and how in all over problems like you told me about the weakness of hands and the legs, how do you feel the pain is there?
Well, right now what I experience is that 90% of my pain I mean, it is not there.
Yes.
10% is there.
Yes.
Which I think that eventually, after some time, it will
keep on going away.
Yeah, keep on going away.
But 90% you already feel better.
Yes, I feel better when you talk about my pain.
Yes. You still have some weakness left.
Yes, a little bit of pain.
Yes, and more weakness. So weakness is basically a symptom which happens because you have not used the muscle because of pain. But now the pain is gone, we keep on exercising and slowly you build away that muscle back.
Okay.
So that way we keep on exercising and it'll get better. Primary thing is the pain has to get away. And how about the weakness in the leg?
Weakness is still there, but I feel more confident while walking right now.
So that simply means that the amount of weakness is certainly less because you don't feel that you'll fall away now.
Yes, right now I don't feel it.
But initially you had that doubt that if you really run or do something complicated.
Exactly. Now, for example, I can walk 2 or 3 kilometers per day.
Yes, but that was not a possibility before.
Before I used to, I can walk, but I may fall down.
You may fall down. So you felt that.
I may fall, yeah.
Yes, I get it. So, okay, just a very small thing, since we are doing this video and there must be people who actually suffering from a similar kind of problem and they have a lot of doubts and they believe that surgery can really help. Would you want to give some message to them?
Yeah, sure. For example, when I was going through this phase since last 1 or 2 months, so I was not stressed because there were a lot of people behind me. My doctor was there, my friend was there, my family was there. But somewhere you have a doubt.
Yeah.
And somewhere you have a stress because when you talk about any operation or surgery, definitely it's not a good thing.
Yeah.
But when I came here and the way the doctors take care of the patient, I mean, you go anywhere, it's the same thing. But I would like to stress more about this hospital and my doctor that he really took care of me. As I said, that my injection was more painful than my surgery. When I went to operation theater, and after 4-5 hours, I was okay. I didn't have a single pain from day 1 till now, as far as my surgery was concerned.
But the collar is messy.
Yes, collar is messy. This is the only thing.
Yes. I give that punishment to all my patients for 6 weeks.
Yes, so this is the only punishment I'm going through.
Yeah.
Otherwise, my surgery was perfect. I never had any kind of pain. And no issue with the surgery. Yes, once this is over,
you'll be the happy man.
Yes, I would win a award then.
Yes, cheers to that. Thank you so much. Thank you,
doctor. Thank you so much.
Thank you.